In the quest for progress and development, access to reliable and affordable electricity is non-negotiable. In Nigeria, the mini-grid component of the Rural Electrification Agency, the supervising agency for the Nigerian Electrification Project, or NEP, has been working tirelessly to light up unserved and underserved rural communities through the deployment of mini-grids. This initiative focuses on 3 critical aspects to transform lives. The first component is the performance-based grant. It's a beacon of hope for private sector-driven mini-grid developers. They receive support to provide clean, safe and reliable electricity to communities that have long been in the dark.
Difference today well. That time we dey spend money, we go buy engineer here, buy everything, but now nothing like that again. Our own na to go load and use our money.
To do my work, I dey enjoy it. Before, as we no get light, I dey do 1 bag for a day. But now, as we get light, I dey do 3 bag of garri. Now they take me enjoy the light. For my shop, if I get light to play music, all my customers they go come buy everything.
When there's no light before, when there's no solar, everywhere you are dark. Now where is solar day, our security are very happy because there are no hiding people. We can hide where we no go see them when their light is on. But before there's no light.
As a result of the solar mini grid we've installed in this community, it's going to give them the possibility of going into agro processing of the crops. For instance, the cocoa can be dried faster now in whatever weather and ensure they can get this cocoa at a good quality to the end user.
Through a result-based financing model, over 113 hybrid mini-grids have been installed across the nation. This means more than 63,000 households and small businesses now have access to electricity that's changing their lives. The second part of this component is the minimum subsidy tender. Here, the private sector continues to play a pivotal role in bringing power to those who need it most. This approach ensures that electricity remains affordable while maintaining high standards of safety and reliability. It's a win-win situation for both the providers and the communities they serve.
Under the performance-based grants, we're proud to say that we've commissioned 110 mini-grids with a total PV capacity of 6 megawatts, directly impacting 280,000 Nigerians. And we see this evidently on ground through less people moving out of their communities to urban areas now that there's reliable and more people moving back into it, so increasing population in these communities. We're also seeing improvements in local enterprises, with people that used 4 generators now being able to use consistent power, and also increase in local enterprises as well.
And then there's the third subcomponent, the COVID-19 and Beyond initiative. In these challenging times, access to reliable power for public health facilities is crucial. This intervention ensures that healthcare institutions have the energy they need to save lives, not only during the pandemic, but beyond. It's a commitment to the well-being of the nation.
This is our isolation infectious disease complex. This complex came up in the 2020 during the COVID-19 era. Ever since we got connected to the solar panels, it's like goodbye to power cuts. We have had uninterrupted power supply in this place, and that has made our work a whole lot easier. Our patients are comfortable, our gadgets are also good. They don't have the challenges of epileptic supply that can affect their functionality. The light has been steady.
It has virtually solved the problem of our electricity in this laboratory. We have been able to use our air condition uninterruptedly. Whenever there's no light from NEPA, they switch us to solar, and it carries everything effortlessly. Our machines, our samples, we're able to store them very well, and currently, that problem of electricity supply to this my department is a thing of the past.
this installation has been the best thing that has happened to the hospital since the inception of the hospital, because now we can solely rely on solar system in the hospital. Every part of the hospital is covered, and it's not been giving us any problem. It's almost a year, going to a year now. The whole of the hospital is covered.
Theater is a place that uses more power, because in the operating suite we need coolness, and if there is no light, there will be no way our ACs will be working adequately, or they will not even function. But because we work to save life, we have hazarded our lives most times. Our comfort has been put aside. So we need light 24 hours. But since the installation of the solar electricity, it has really curbed such problems.
The machine is using electricity. So due to inadequate lighting, we are not been using it. So now, with the presence of solar, so that's why we bring it out, so that we've been using it.
The mortalities we used to incur then, because there was no light, like in 2018, if you check the assessment just for the period of 6 months, 2018, January to June, there was about 38 women that died during pregnancy or after delivery, and most of the challenges were linked to issue of light, and more than 300 babies died. About 305 babies died because of that. So telling you that in each month as of then, about 6 women, not less than 6 women, some of them are young, in their 20s, some in their 30s, just dying because of pregnancy issues, that you needed light to help you to manage them, but sometimes if you refer them, they will not go. In fact, we had people that said they don't have money. If you refer them, they will say they will not go anywhere, that we should do whatever they will do. So sometimes you find your hands were very tired as of then. But all these issues are almost bygone issues.
Within the period that the light is off and on, if I need to resuscitate a child or to nebulize a child, it has been a big challenge in the world. But with the installation of the solar, when the light is off, that solar system have helped to relieve me of the challenge of nebulization and resuscitation of the baby, thus reducing mortality.